Good morning, everyone. Uh, I'm Dr. Amogh, and my talk today is on the comparison of wet lab skill training in novel mobile-based virtual reality platform versus conventional training. So as surgical residents, when we pass out of college, the most important thing that we notice is there is a huge imbalance between the surgical skills that we acquire in the college and the required proficiency that is required in the hospitals outside. So how can we bridge this gap? There are virtual reality simulators, as I would allude to Dr. Astha, Dr. Ishwa's talks, but they are very expensive. So do we have an inexpensive method to tackle this problem? This will be my talk today. So what are the challenges that we face in ophthalmic surgical training? Basically, there's the high cost of microscope, and the difference between surgery that we do in internship and in ophthalmic residency is that there is an element of stereopsis or microsurgery, which cannot be done without high-end equipment. So there is limited training access even during surgical residency, and there are institutional constraints. So what can we do to overcome this problem? We can have immersive training, like-to-like training, basically like a virtual reality headset, and it has to be comparable to conventional training. So the four aspects that we have in virtual reality are the virtual reality environment that we create, the immersiveness, the feedback, and the intent that the method that we have, does it do that? So I've come up with this because I did face these problems during residency. I've named it Vardhan after my son, so it's basically virtual augmented reality, developing an advanced anatomical navigation. So this is the setup. So basically it's the inexpensive virtual reality headset which costs around 500 rupees, it's off Amazon. And then you connect it to a Android phone. And this can be used as a virtual reality headset. Basically this bypasses the microscope, which in itself will cost you upwards of 1 lakh. So you can give it any webcam feedback, basically USB camera feedback, and this can be connected via USB-C to a normal USB converter, which is again inexpensive. To reduce the working distance, you add a 10 diopter PMMA lens, which again will cost you peanuts. And this is portable and cost effective. It can actually be used for surgical training and to show biomedical or allied professionals what you see during surgery. So the study that I did was a non-randomized experimental study where I involved 20 ophthalmic surgeons, 10 beginners and 10 advanced surgeons. And they did corneal suturing on porcine eyes. And this was the evaluation metrics. We measured surgical time, the precision, and the surgeon's feedback on how they felt the device was. These are the results. As you can see, there is not a lot of difference between conventional microscope and the VR platform that you use. Even there is comparable between the beginners and advanced surgeons. So beginners adapted faster with virtual reality, and advanced surgeons performed similarly in both the scenarios. And then we took the feedback on depth perception. As you can see, around 80% of the people, they agree that that was easy to use. There might be a hitch on getting used to it, which takes around 5 to 10 minutes, and once they get used to the platform, it is very easy. They have good depth perception, and it's very easily accessible and affordable as well. So it's a cost-effective alternative to the virtual reality simulators that we have in the market, like Help Me See or IC. And it is near real experience, as you have actual feedback instead of haptic feedback. And once you add a 10 diopter lens, which you stick it to the front of the web camera, it reduces the working distance, which gives you an actual feel of working in the operating room. You can do this at home as well. So it is a mobile-based VR platform which allows training in diverse settings. So future scope of this would be to add feedback. Basically, you could record somebody operating and then give feedback on if the person is performing well or not. You can record. You can probably hold the camera close to where the surgeon is operating, record virtual reality videos, and you can do amblyopia therapy as well, perimetry. So this is the app face front. This is the front face of the app. And my conclusion is this is a cost-effective and accessible alternative to traditional wet labs. It has potential to reduce the cost of training and revolutionize ophthalmic education and make training more efficient, scalable, and globally accessible. Thank you.
So do you think there is any limitation to it? Any limitation according to you?
Right now, the initial problem that we faced was placing the USB camera, but I would want to now we have overcome that. by creating a holder. In the future, would probably create a 3D model, 3D printed model to place the camera, which would make it easier to place the cadaveric eyes and the camera and practice suturing.
So except you, is there any other surgeon
There is no others.
who has used it and appreciated it? Was
This was a study on 20 surgeons,
okay.
basically, and they have appreciated the model.
Look like the feedback
Yes,
you
the
can
feedbacks.
mention on this.
It was here. This is a feedback. Basically, this is from 20 surgeons, 10 beginners and 10 seasoned surgeons, and we wanted to see if they actually get the depth perception that we intended to give.
Thank you. Nice.